All right, welcome everybody to this month's National Equine Health Conference call. If you could make sure all your lines remain on mute, it'd be greatly appreciated by our speakers. And thank you again for those of you that have provided your topic suggestions for this call. And I welcome them for future calls. As far as future calls, just a reminder, our next call will be June 13th. Again, same time and same call-in, Zoom call-in information. So without further ado, I will get started with today's speaker. Topping our agenda today is a very prevalent topic and a lot of conversation about it. It has to do with high path avian influenza and what do we have to worry about here with our horses. I'm going to turn it over to Dr. Chambers with the Gluck Equine Research Center here in the University of Kentucky. Take it away, Dr. Chambers.
First, let me see if I can share my screen here. Is that the right one? Okay, in a way, high path avian influenza is come on, start the show. Is kind of a return home for me. I worked with from now on, I'm just going to say HPAI, meaning high pathogenicity avian influenza. And I was saying it's a return home for me because I've kind of got started in this field like 40 years ago at St. Jude Children's Research Hospital, working on H5N2 HPAI. And back then it was we did not even wear respiratory protection, and so maybe I'm immune to it still. The situation now in spring 2024, it has spread to as of a week ago, it has spread to 36 dairy herds in 9 states. There have been 2 human cases. These have both been mild, although historically, if you think back to like 1999, 2000, in China, in Hong Kong, there were a handful of human cases, but they were like 90% fatal. Okay. And so is there a possibility of something like that happening? Well, yes. Okay. The HPAI have also been detected not just in cattle and humans, but cats, seals, goats, mink, and historically, over the last 10, 20 years, have been detected in tigers, leopards, both domesticated and feral animals. So far, and somebody correct me if I'm wrong, but so far there have been no reported detections in horses. And I say yet because I'm expecting that call to come in. I've been expecting that call to come in for the last month, quite frankly. Now, can it spread into horses? Can high path H5N1 influenza spread into horses? We don't know. Like I said, I thought it would happen already, and it hasn't. What we do know is that something like this has happened before. In fact, all the known equine influenza viruses, the A1, H7N7s, now believed extinct, and the A2, 3, and 8s that are widely circulating, these all have a presumed avian influenza genetic origin, back in their three-horse viral ancestors. Somehow for that to happen, avian influenza viruses must have somehow got into horses. And so presumably it can happen again. Now, there have been, of course, there's no documentation of avian influenza in horses, with the exception of an H3N8 outbreak in China in 1989. Okay, but over 100 years ago, about 150 years ago, there was what was called equine influenza. It had all the classic symptoms of equine influenza in the United States, which was coincident with high path avian influenza. And that was the pre-virology age, and so there were no virus isolates. But now that we have genetic tools, we can do sequencing of the historical virus isolates that we have and extrapolate backwards, do comparisons. And the finding of this paper in Nature from, I think it was 2014, was that the equine A1 lineage, the H7N7 lineage, as you can see here, is a sister clade to strains from birds. And in fact, in terms of its, if you put the equine H7N7 virus into chickens, it will kill the chickens. So it is definitionally equivalent to a high path avian influenza virus. Now, it was not particularly high path in horses. In fact, it was probably less severe than the H3N8s that came along a few years later. And we don't understand why it was not considered high path in horses. Now, there have been, see if I can get rid of this here. There have been reports of HPAI in donkeys, similar unconfirmed report from Pakistan. In Mongolia, examinations of equine sera have found antibodies, but no association with disease. In laboratory cell culture, this is my own lab's work. We tested a variety of avian influenza viruses in cultured horse tracheal cells, and they did replicate. We put some of those into horses, and they did not replicate. So why not? We don't understand that either. The first thing we look at is receptor binding, and really that the idea is that if the virus cannot bind to cells, it can't infect those cells. And so if it cannot bind to horse tracheal cells, then it can't infect horse tracheal cells. And there is a rationale why that might be the case, because horse tracheal cells are a little different in the type of receptor that they express. They express what was called the N-glycolyl sialic acid, which avians do not express that. Okay, but the kind that avians do express, the N-acetyl sialic acid, apparently does show up in some locations in the horse respiratory tract. And in cell culture, we did see virus replication, and so the virus must have attached to those cells. So the idea of receptor binding kind of
84.
falls down in this and as an explanation. We really don't understand the underlying biology of how an influenza virus selects or how it transmission from an avian host into horses, where the log jams are, what makes it permissible or what makes it not permissive. Can I get my computer's locked up here? Okay, so is that okay? Here we go. Now, in cattle, what is observed in cattle maybe subclinical or clinical infections. They predominantly find the virus in milk and mammary tissue, and these are not the typical um, uh, samples that are submitted for horses. Um, Decrease in rumination and rumen motility. Well, that, we could look at anorexia in horses. Respiratory signs. These sometimes appear in cattle, sometimes do not. Of course, we don't look for milk drop in horses. Um, the signs may include loose feces, lethargy, dehydration, fever, and these are pretty typical of normal equine influenza. Colostrum and milk production, like I said, we don't normally look at. So what will we see in horses? Until we get cases, we don't know. In cats, there were neurological signs. When horses exhibit neurological signs, the first thing we expect is the HB1. Like I said, the respiratory signs in cattle, fever, anorexia, nasal discharge, pneumonia, we can see the same things with normal equine influenza. In humans, the conjunctivitis, that's not normally looked for in horses, and I would not be surprised if um, if normal equine flu could produce conjunctivitis. So what would we see in horses if we get a case? I don't know exactly how we would distinguish it from normal equine influenza. The rapid detection kits that are sold for detection of avian influenza in cattle, that's cattle do not normally contract an avian influenza virus, and so if they get the respiratory signs consistent with influenza, you can use these rapid detection kits and say, is it positive for influenza or not? But, we have tested some of these kits in the past, and labs have done the same and found that not all of them, but some of them do also detect normal equine influenza. So how do you tell them apart? I saw Nicola Pustrala is attending this meeting, and maybe Nicola, you might have some thoughts on that subject. So our recommendation, if you have what looks like equine flu and the horse is in proximity to an avian or bovine HPI outbreak, you should really think hard about HPAI because we can't rule it out. Call your state vet. In central Kentucky, you could please also call me. We'd be keenly interested. And, this is me over here on the right side of the screen. This is how we would get dressed up to collect samples from those horses. Now we would likely need veterinary assistance, for example, to tranquilize the horse. Now those swabs will go to the University of Louisville, which has a BSL-3 lab certified for HPAI work. Now USDA has guidelines for veterinarians reporting HPAI in cattle. Okay, talk to those that talk to your state vet. Contact the APHIS BS area veterinarian in charge. Submit samples to an NAHLN laboratory. Here in central Kentucky, our own diagnostic lab is an NAHLN lab, and they do avian influenza testing. The ones that come back positive would go to Ames for confirmatory testing. The BSL-3 lab in Louisville will likely do the same thing. We can assume that if horse cases start to appear, that USDA would have very similar guidelines for handling samples from the horse cases. Finally, I'll just conclude saying USDA now for cattle requires a certificate of veterinary inspection for interstate movement, which basically means you have to be certified free of influenza. If cases appear in horses, we can expect the same thing. Restrictions, freedom from influenza for interstate movement. If you have a suspect horse HPI case, now best not to move it. Here we have two horse hospitals in Lexington where they may be willing to accept severe cases of horse with that might be suspected with HPAI. I don't know that. They might refuse it, but you should, if you're a veterinarian with one of these cases, talk to the state vet, talk to the local horse hospitals, but don't move the horse without guidance from those, from the state vet and from the vets at the hospital. Put in strict quarantine procedures immediately, which means no contact with other horses. Wash your hands, if possible, wear respiratory protection such as N95 masks. And with that, I'll be happy to answer any questions. And Nicola, if you have anything to add about the testing, I'd be interested to hear.
So Dr. Chamber, we already have some questions here. So first I see Dr. Tell has her hand raised.
Yeah, thanks so much, Dr. Flynn. Thanks, Dr. Chambers. I just wanted to clarify two things. That Zoetis Flu Detect assay is a pan-influenza A test, and so we would have every expectation that it could detect the normal equine influenzas, but wanted to note that it's only licensed for use in poultry at this time, and so that's an important thing about a USDA licensed kit. And then the other thing I wanted to notice to follow on your presentation is that the non-labs who are approved for AI testing and have those assays implemented must have the deviation in place in order to test mammalian samples. And you got to have that in place before you test the mammalian samples using the flu A assays or anything downstream of that for subtyping. Thanks.
Thank you.
Much appreciate that clarification. I've got two questions here. Is there a plan to do a challenge study in horses with the current outbreak strain? Is the first question.
Well, we could not do it here because you would need a large animal BSL-3, which we don't have. There are such facilities around the country. Jürgen Richt in Kansas has one. There's others, I believe, in Wisconsin, Colorado State, maybe one or two others. So, possibly they have such plans, but I can't speak for them.
Okay, I've got a second question for you. Will any of the equine flu vaccines help protect horses from the current outbreak strain?
Good question. I don't know the answer. If I had to recommend a vaccine for the HPAI, it would be the Merck Fluivert, which is a modified live virus vaccine. I have to say straight up front, I'm a co-inventor of that vaccine, and I get royalties for it. But the reason why I recommend it is because it produces other kinds of immune responses besides just antibodies to the hemagglutinin and neuraminidase. and some of those immune responses and also features like if you use it, just within 24 hours or so of exposure to the HPAI, now there might be some kind of interferon response effect that would be cross-protected. Okay, but none of that has been tried. So it's just a guess on my part.
And the last question we have time for, and I'm not sure you can answer this one, but I'm going to ask it, is have challenge studies been done in cattle?
I don't know the answer. I know people like Andy Bowman at Ohio State, who I think is keen to do that. I don't know if he can do it at Ohio State or if once again someone like Jürgen Richt in Kansas might be the person who would be conducting those studies.
Well, this has been very, very informational for all of us that are getting the question about what about the horses. So we'd certainly appreciate your time, Dr. Chambers, and appreciate your efforts in helping us with all of our equine influenza questions. So thank you for your time, and we'll just move on here. The next speaker is going to be Emily Stearns with the American Horse Council. And Emily, I know I'm going to give you screen. Give me 1 second.
No worries.
Give you access. I got to find you and then give you access. There you are. You should be able to share your screen at this time.
All right. Can you see that?
Not yet.
Working on it. How about that?
Yes, ma'am, we can see it.
Excellent. Okay. So hello from the American Horse Council. I'm going to talk about two things kind of briefly today. One of them is our annual meeting is in June 9th through 12th. That is being held in Washington, D.C. And we have a robust agenda lined up. We were actually just counting our speakers yesterday. We have over 26 speakers invited to attend and give presentations over the 3 days. Highlights will be a social license to operate and an owning responsibly discussion with David O'Connor and several other guest speakers, including someone from National Animal Care and Control. We have the Coalition of State Horse Councils giving a grassroots advocacy presentation. We have someone talking about equine assisted services, learning how other associations develop their policies. The Equine Welfare Committee will be hearing a presentation on equine euthanasia and disposal from Dr. Michael Murray and Dr. Emily Cornell. And the Equine Health Committee will be hearing a presentation on veterinary workforce development. And the focus of this panel discussion will be not that statistics related to veterinary workforce development, but the actual programs that have developed out of those stats that came out of AEP a couple years ago. So it'll be leaders of those programs talking about the impact and change they're trying to put forward. On top of that, in the annual meeting, you can see the register and view the full agenda at horsecouncil.org. If you do plan to attend and book a hotel through the room block, you need to book through the room block by May 17th. That can be done through the registration link at horsecouncil.org. But one thing we will also be discussing there, or at least sharing while I'm there, is talking about an initiative that the Equine Health Committee has put forward, which is, see if I can get my slide to change. You want to change? There we go. Is the American Horse Council, the Health Committee has put together an international movement working group. And this international movement working group, the goal is to help understand what's working in international movement, what's not working in international movement, an opening discussion with international movement stakeholders on how the Horse Council can help support international movement moving forward. We are hosting a town hall Tuesday, May 14th. That's next week at 12 p.m. Eastern Standard, which will go over the goals of the International Movement Working Committee and a couple of things we've already started in terms of getting feedback on stakeholders in terms of what's working for them and where they see areas with room for opportunity. So one thing that we'll be discussing at the town hall is an import-export feedback form we've made. You can see the link down below, but I'm just going to show you really quick what that looks like. Let's see if I can get the right one. Can you see the form, Katie?
Yes, we can see the form.
Great. So this is the form we'll be sharing at the International Movement Working Group Town Hall next week. It's just a feedback form. We want to hear not just what people are experiencing difficulty with in terms of international movement, but also their successes and what's working really well. One thing we've noticed in terms of kind of feedback on international movement and importing, exporting horses is that, especially for us at the Horse Council, we get a lot of feedback anecdotally, oftentimes kind of months or a year after it's happened. And we don't have a good idea of kind of what the main issues are. So this gives us a way to kind of organize everybody's thoughts, identify key priorities, and kind of develop an overall understanding of what direction we need to be taking in terms of advocacy for supporting import and export and international movement as a whole. Again, this will be available for any stakeholders, transporters, veterinarians involved in international movement to provide feedback. Again, and let me just get back to sharing the other screen real quick. That town hall is next week. We do ask that you register to attend just because we max out at 100 people in terms of the Zoom invite, and we were already at 75 when I looked this morning. So there is a lot of interest in kind of people understanding and coming together and working together to better support the international movement. I think I'm at my time limit, Katie, so I'm happy to take some questions.
Any questions, comments for Emily? One thing I will mention is for folks on the call or folks you may know that do have an interest in international movement of these horses or have concerns, reach out to Emily or myself and we can put you in contact with the form if you can't copy it off the screen today. This will also be recorded and posted. This call is going to be recorded and posted to the Equine Disease Communication Center. So all of our monthly calls do go there, so you can come back to get this information. But we strongly encourage folks to start telling us the examples as they happen of any successes or challenges associated with international movement, so that we can work together to address those issues as an industry and working with USDA. Any other questions, comments, or concerns? All right, I'll leave that up there for a minute. And thank you, Emily. We are going to transition now to Dr. Paul Lunn and Dr. Brandy Burgess, as ACVIM has put out a new EHV 1 consensus statement, and I wanted to give them an opportunity to give us some of the highlights from today. Emily, can you stop sharing your screen and we'll be good? Thank you. Turning over to you, Dr. Lunn and Dr. Burgess.
Thanks, Katie. Can I share a screen if I need to?
Yes, sir. Let me make you co-host. Give me 1 second.
Okay, great. While you're doing that, it's great to see or know at least a lot of friends and colleagues, some very old friends and colleagues, literally, are on the call today. Nice to be in the same space as you, and particularly with my some of the co-authors, Brandy Burgess, of course, also Nicola Pistola and Lutz Goering on the call with us today. And I would look forward to referring to their opinions when we, for some of the questions you might ask or things we want to address. And I really want to recognize Gisela Sabol-Hussey, of course, very important EHV researcher who is another author. And two people you won't know, Peggy Gross, who's a librarian at NC State, and David Dorman, who is a toxicologist, but an expert in systematic reviews. And their help, particularly that of Dr. Dorman's, was absolutely pivotal in this. You should be able to see a shared screen. Somebody give me the thumbs up there or let me know that's happening.
Yes.
Good. So what you can see there is the original publication title of the first consensus statement and the questions. And that was published in 2009, which means that the thinking was contemporary in 2007 or 8 when the thing finally got written and appeared in that form. In 2019, the Board of Regents, based on input from diplomats at ACVIM, asked us to revise a new group of authors to revisit this consensus statement with an idea that we would submit it in December of 2020. You can already work out how well that went. The early decision that we made was to try and be more rigorous and evidence-based, formally evidence-based, to consider and ultimately decide to take a systematic review approach to this. The first action we did was to reevaluate the last statement and to ask the membership of ACVIM for input and what were the most important challenges. And we met in Phoenix to put those questions together. What we discovered from the numerous actual responses we got from the membership is that all the old questions were still thought important, but several new ones were identified and they're captured here. And we decided to address originally 5, but finally 4, and 4 still turned out to be ambitious questions as they are listed. Each of these was conducted as an independent systematic review. And in most of those instances, there was meta-analysis involved. And in one instance, we had to do this as a narrative review because of the limited data that was available. Systematic reviews are widely regarded as the highest level of evidence for decision making, but they are a bit of a dark art, and they were certainly a dark art to me. If I'd understood how challenging they are to do, I never would have been mad enough to undertake it. Fortunately, I was part of a large strong group. Brandy Burgess is an epidemiologist, a lot of experience in this sort of area. And we set sail to try and accomplish this. Now, the processes are well defined. Anybody who'd like these slides afterwards is more than welcome to them. I'm not going to drag you through each, but early on, we discovered that our bandwidth, our capacity, and our experience with this technique, even with Brandy on board, was somewhat limited, and there was a massive amount of work to do. This is where Dave Dorman stepped in and gave us enormous help. He's a real expert in this area, and I would urge any of you to consider him as a colleague if you undertake this kind of work again in the future. He quickly helped us understand how to follow best practices. These are well described in the literature, although it is a continually evolving art. We were able to recruit a medical librarian and set up our teams and use approaches that I'm not going to spend too much time on right now. But we were lucky to have subject matter experts, and we needed to recruit actually workers. We recruited veterinary students to help us with data extraction and a variety of processes and trained them. The amount of work that could be done for this project was really quite phenomenal. So the rest of that presentation was something we showed at ACVIM several years ago, and we don't need to go through that. I think this would be a great time for people who have questions to maybe feed those into the chat. I'm not going to go on for very much longer. So we did our 4 reviews. One that might be of great interest is the review around vaccination. And I would like to point out that another systematic review on this topic appeared, authored by Maranzoni. I believe that was from the lab of Dr. Peter Timoney, and I think Dr. Timoney is on the call today. So not the first reviews done in this area, but quite a comprehensive set of reviews. And at the end of conducting a systematic review, you end up with evidence, one way or the other, in favor or not in favor, in support of the question. And in the example of vaccination, the question was, does vaccination protect against EHV1 infection and disease? And the answer is that the evidence is very limited. It was very similar to the outcome of the Maranzoni experiment. There was limited evidence. Then we had to reach a consensus, which we did using strategies that is described in the paper, in order to give an expert opinion based on the hard, if you like, evidence from that systematic review. And despite the fact that there is limited evidence of efficacy, there is some evidence. And as experts at this point, you basically have the responsibility of making a recommendation for people to consider as they decide how to do veterinary practice. We don't always, as veterinarians, clinicians, have all the information we would like to have or need to make a firm conclusion, but we still have to act. And our action in this case was to say that although our confidence was low to medium in terms of the value of vaccination, that we continued to recommend its use, but very much on a risk assessment basis. And similarly, we conducted reviews around the value of pharmacological treatments. The values, there is no evidence of value of pharmacological treatments that we studied after the onset of disease. But there is some evidence from a couple of studies that if given in advance of infection, which you could do in a herd situation when infection is spreading through a group, that there may be some value in drugs such as valacyclovir. We looked at the severity of viremia and does it correlate with the occurrence of abortion or EHM? And the answer is no, it does not. Neither the severity, the degree of viremia, nor the duration. However, you do not see EHM or abortion without viremia. And that may come as no surprise, but it also perhaps brings about what I think is a quite important recommendation for vaccine development. If we are unable, either for ethical or practical reasons, to replicate EHM in a group of experimental horses, or abortion for that matter, then a powerful surrogate may be viremia. So our focus in the future perhaps should be directed towards preventing viremia as a surrogate for, or a prediction for ability to control those other two conditions. And the final study was around sampling technique to detect the HV1 infection. And of course, Nicola led on this. And we recommend both nasal and blood samples in any instance where this can be done. But when cost is a limitation and we're not dealing with abortion, then nasal samples are probably going to be the most sensitive. In the case of abortion outbreaks, one might well prefer to go down the route of taking blood if you can only do one, but you would very probably do both, but do not neglect to test blood samples. Finally, we did review all of the original 9 questions and review our answers to those. And I'm not going to go through all 9 of those, or Katie Flynn will no doubt have to stop me. But I will refer to some of the conclusions that we made around the conduct of studies. We need and must have more robust studies with adequate statistical power going forward, more consistent reporting following many important guidelines that are now published widely, the ARRIVE guidelines being a great case in point, and which continue to evolve over time. Because we looked at all published evidence in the English language that we could find in referee journals, we certainly looked at some very old papers that may really have paid attention to different standards than we use today. And some more recent studies performed better, but not all of them did when we looked at the risk of bias and various criteria about the quality of the study. The quality of studies is imperative if you're going to do them at all, if you're going to put horses through those challenges, and if you're going to spend the money that's been gifted to you to do that. And the last point I would make, which was not in the systematic review as we published it, but was a very good comment from an old colleague of mine, Josie Traub Dargat, who I think is also on the call, is to always remember that experimental outcomes do not necessarily exactly predict what is going to happen in real life. I'll stop there. I don't know if any of my colleague authors, Brandy in particular, have anything they'd like to add.
I think, Dr. Lund, the only thing I would say is an additional comment when we look at sort of the evidence that we had to look at. Oftentimes it was hard to evaluate the quality simply because things weren't reported. And so that was the other challenge, is we actually couldn't tell what was done or how rigorous it was. And so I think that was the other lesson, was make sure that you're being very transparent in your reporting, because it will help us do this type of work in the future, and leverage all the data that we have, right, to make decisions. So I think that was one thing that I would add, Dr. Lund. I don't know if Dr. Pistola or Dr. Gehring have additional comments.
Nicola, Lutz, anything you want to bring forward?
I
Nope.
have received a couple questions, so if
Okay,
if you would like
thank you.
those. So the first one I have, and it might go back to your original consensus statement,
Yep.
because it wasn't something that was addressed in this one. The question comes, as far as the period of quarantine that is recommended, where did the 28 days come from?
Well, in the original statement, it came from our opinion based on looking at the papers. However, I think I'm going to punt this one to Lutz or to Nick, whichever of the two of them would like to jump. They have more firsthand and contemporary experience of managing outbreaks, and I'd be keen to hear their opinions.
Shall I start?
Please.
I would say the 28 days were like, they are from an original paper from George Allen, and they were somewhat at the very beginning when we got the first PCR results in, and they were an add-on. We don't have sufficient quarantine time with the 3 weeks, so we should add another week. I think it was a very, very loose statement. That's where the 28 days were coming from. Nowadays, I think we experience that some horses during an outbreak may shed longer. I think the advantages of repeat detection, PCR detection, has added value to this quarantine period.
It's also worth maybe the other thing is that this outbreak does not move as explosively through a group of horses as influenza. So that start time for some horses in the group for shedding maybe some days after the first cases, and further extend the period that EHV1 is in circulation.
Yeah, and I think it's hard to tell too, because we know that the shedding isn't really related to severity of disease. Both magnitude of shedding or duration of shedding doesn't seem to be related to that. So I think it can be tricky without testing, how long you should wait.
Nicola, do you have anything you'd like to add or any comments?
Personal opinion, which is probably not worth much, but we have to consider that every outbreak is depending on the population, and these are very conservative guidelines of 28 days. Now, I would say my biggest concern is always the silent transmission during an outbreak. We only recognize clinically affected horses, and the number of clinically affected horses will decrease over time. However, silent shedding may not necessarily. If you want to shorten the 28 days, then molecular testing will be the only option. And remember, these are conservative guidelines.
Well, thank you. The one thing I would say on top of that, though, is after we came out with them, there was a huge amount of pressure to reduce that number to 21 days, which is what happened in the AAEP guidelines at that time. And that was simply because veterinarians had a terrible time persuading owners to isolate for that period. There was a very large racing establishment with a rather famous female horse of the age, you can guess, who was on site and couldn't leave due to an imposed quarantine. And therefore, the testing strategies that my colleagues are referring to probably have an important place in that setting. What's next?
Yeah, and just from my perspective as a state animal health official for 20 plus years, in our outbreak situations, we did go with 21 days, and most of our guidelines from a state animal health officials is 21 days, because exactly as you said, it's very hard to keep horses under quarantine for a longer period of time.
It becomes about risk appetite and risk aversion. I mean, ultimately, you know, you've got to find that balance in the real world. The threat of infection diminishes probably a great deal in the fourth week, as it were, between 21 and 28 days, but it does not go away.
Yeah, I would definitely agree with those comments. And again, it's risk-based and situation-based, as everyone said. Can you explain a little bit more about the 14-day quarantine period strategy?
I presume this would refer to 14 days followed by sequential testing of all the horses. I'm going to go back to Lutz and Nick to see what they think. Is that what?
Unmuted already. This is exactly what Paul Morley suggested in the hospital outbreak at CSU. This was a strategy to place horses into a semi quarantine and release them from hospital quarantine, but under stringent diagnostic conditions.
That's right. I think, Brandy, did you work that out? I know Lutz worked. We never saw Lutz for a couple of weeks as he lived in isolation, saving several horses in the process. Were you involved in that one too? Is that
Not that one, but I had my own at the University of Saskatchewan that we were doing something similar.
Yeah, so I think Lutz gave probably the best answer there you could get.
Next question is, can you please expand on your thoughts on prioritizing and preventing viremia and strategies on how to do that?
Okay, I think somebody's got their mic unmuted and their phone ringing right now. Thank you. If you could, ideally, somebody turn that off. I'm not sure who it is. So in terms of preventing viremia, you know, our best intelligence is around, you know, what sort of vaccination strategy you can use. I presume the question relates to that, Katie?
Yes, I'm guessing. Yes.
Yeah, I mean, there are papers out there that claim significance. Maybe they'll hang up in a minute. There are papers out there that claim significance for the prevention of viremia. I think I've got my name on one with Lutz, looking at some types of killed vaccines, but they did not stop viremia happening. They may have reduced the degree of viremia. At least we were able to achieve some level of significance. So we really don't have strategy that I'm aware of, my colleagues will chip in here, I'm sure, which stops viremia. And the conclusion of one of our consensus statements here was that the degree of viremia, the duration, did not seem to make a difference in terms of the disease outcome. The disease would come if there was viremia. So we really need to be looking for vaccines, which I don't believe exist currently or are described currently, that prevent viremia from happening. So that is out of our reach at the moment. Other comments? That's what we got.
Those are all the questions that I have at this time. If you have additional questions, please put them in the chat or unmute your line to ask the question at this time. We have maybe 1 minute to do another question. Okay. Thank you all. We appreciate all your time and efforts for everyone associated with that paper. So thank you, Dr. Lund, Dr. Burgess, Dr. Pastola, and Dr. Goring for your time today. All right. With that being said, I'm going to transition to Dr. Brault with USDA. She's going to give us an update on APHIS posting sources sought notice for equine foreign animal disease vaccines and diagnostic tests. You need to give me a shorter subject title next time. There you go, Stephanie. You're on mute, Stephanie.
Oh, sorry, it was resistant. It was a resistant mute. So I'm here now. And let me decode that for you a little bit. What I just wanted to share with you today is that through all the discussions, ongoing discussions we've had about foreign animal disease, you know, on the equine health team, we've recognized the importance of improving preparedness for possible incursion of foreign animal disease by identifying sources of vaccines and associated diagnostic tests ahead of time. And so we consulted with diagnostics and biologic staff, and we determined that the best way to go about improving our awareness of that is to do what they call posting a sources sought notice. And so that's what we've done. And it's a public notice that's on the sam.gov site. And so I'll just put a, in the chat, I just did a screenshot of it. And then here is the link to it. And so basically what this does is it just puts out a call to anyone who manufactures vaccines or diagnostic tests that we're interested in finding out about that. It's not a posting for any sort of procurement. It's not an intention to set that up or set up any sort of stockpile. It's merely market research is all it is. But through DMB consultation, we found out that this is the best way to do this and really get the word out throughout the world. And so if you're aware of any possible sources that might want to communicate about that, the instructions for doing that are on the posting, and they can submit that information there. So does anyone have any questions?
I'm not seeing any in the chat. I don't see anybody raising their hand or unmuting at this time.
Okay.
All right, then. Thanks, Stephanie, for that update. We have a few more minutes. If there's anybody that's got any quick updates or information they want to share with the group, please feel free to do so at this time. I would also remind you that our next call is going to be June 13th, same call-in number and at the same time. I always welcome ideas and thoughts for speakers and topics, and I appreciate all the time and effort of our speakers today. Give me about a few days to get this recording transcribed, and that recording will go on the Equine Disease Communication Center website. So if any of you are interested in previous recordings, February, March, and April have been posted, and we'll post this one as well. Again, thanks our speakers, and thanks everyone for your time today. I hope you have a good rest of your week. Thank you, everyone.
Thanks.